Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Isocarboxazid. Its brand name is Marplan. And before we talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. In this presentation, we're going to be talking about how this medication works, reasons we would prescribe this medication to a patient, contraindications or reasons we would not be able to prescribe Isocarboxazid. We'll also discuss examples of dosing and side effects. I've put together some slides to go over this information, so let's just jump right into it. So the first thing to discuss would be the mechanism of action, or how this medication works. So isocarboxazid, or Marplan, non-selectively inhibits monoamine oxidase, or MAO, in the brain, heart, and liver. In terms of indications or reasons we would prescribe this medication to a patient, the only real indication here would be in depression. Now, in terms of contraindications or reasons we would not be able to prescribe isocarboxazid, we wouldn't give this medication to a patient who had cardiovascular disorders, hypertension or high blood pressure, or patients receiving antihypertensives or diuretics. This medication is not to be used with antihistaminic, sedative substances, and CNS depressants. Patients who have used bupropion in the previous 14 days cannot use isocarboxazid, or if they've used buspirone in the previous 10 days. This medication should not be used with dextromethorphan, or SSRIs, selective serotonin reuptake inhibitors. If a patient had a history of headaches, they would not use this medication. Also, if they had a hypersensitivity to isocarboxazid or any other component of the formulation, that would also make this a contraindication. If a patient had severe renal impairment, they would also not use isocarboxazid. Now let's discuss dosing with isocarboxazid. So in the treatment of depression, the initial dose would be 20 milligrams per day, orally, divided in 2 doses. The dosage may then be increased every 2 to 4 days by 10 milligram increments to a maximum dose of 40 milligrams per day by the end of the first week. After this, they may increase the dose in increments of up to 20 milligrams per week to a maximum of 60 milligrams per day, divided in 2 to 4 doses. For maintenance therapy, they would decrease the dose slowly over a period of several weeks to find the minimum effective dosage. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using isocarboxazid, so I'll go over some of those here now. Constipation may happen 4 to 7% of the time, and nausea may happen 4 to 6% of the time. 6 to 9% of patients may experience xerostomia or dry mouth, and dizziness may occur 15 to 29% of the time. Dysomnia may happen 2 to 5% of the time, and a headache may occur in 6 to 15% of patients. Insomnia may occur at a rate of 4 to 8%, and orthostatic hypotension, or a sudden drop in blood pressure when going from a seated to a standing position, occurs at a rate of 4%. 0 to 2% of patients may experience palpitations, and as well 0 to 2% may experience syncope or fainting. Suicidal thoughts are also a possibility. Alright, that's all we're going to talk about today with isocarboxazid or Marplan. As always, I'm very thankful you took the time to go by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.